Hi, my name is Stacy Barajas, and I am performing my head-to-toe assessment for Maryville University Nursing 612. This is my patient, Josie. She has volunteered to participate in the video today, and she has opted to, instead of a gown, wear a tank top and shorts. Prior to the examination, Josie has emptied her bladder. We have measured her vital signs. We've taken a measurement of her height and her weight and her BMI. And we also have checked her vision using the Stellan chart for distance and the Rosenbaum chart for near vision. So first, to get started, thank you, Josie. We are going to do a general inspection of the head and the face. We're just going to look at the hair in general and the skin of the head and the face, noting that it's normal color. It is warm, dry. The hair is soft to touch. It's non-brittle, and it is evenly distributed throughout the scalp. And we're just going to do a rotation inspection of the scalp, and it moves freely. There appears to be no masses or any nodules noted, and no rashes or dryness, skin dryness. And then we're just going to do a general inspection of the ears and the eyes, and they appear normally placed on the canvas, and they're midline and symmetrical on both sides. Then the scalp is normal cephalic, noted. And then we're going to assess the cranial nerve number 7. So Josie, if you could please clench your teeth, puff out your cheeks, squeeze your eyes, wrinkle your forehead, stick out your tongue, and smile. And that assesses for cranial nerve number 7. Then we're going to palpate the facial bones. We're just going to apply some moderate pressure, not too deep pressure, and we're just palpating for any masses or any tenderness or pain. Is there any?
No.
Thank you. And then we're going to assess the temporal mandibular joint, and we're going to do the assess for any popping or clicking or pain or tenderness. If you just please open your mouth and then shift your jaw from side to side, any pain or tenderness.
No.
And we noted no popping. So that is normal findings. And then we're going to assess the sinus regions. We're going to assess for the frontal sinuses, applying a little bit of pressure. No noted swelling. Is there any tenderness or pain upon palpation? No. And that is normal findings as well. So next we're going to move on to cranial nerve number 5, and we're going to assess for light sensation using a cotton tip. For this side will be soft, and this side will be hard, and we're going to assess on both sides of the face, and this is cranial nerve number 5. Okay, can you please close your eyes? Okay, just let me know if it's soft or hard.
Soft. Hard.
Soft. Hard.
Soft. Soft.
Okay, and these are normal findings. Next, we're going to look at the eyes. We're going to assess the eyelids and the eyelashes, and we're noting that her eyelashes and her eyebrows are evenly distributed. Her eyelashes form in an upward motion, or upward direction, excuse me. And now I'm just going to gently palpate the eyelids, and I'm just assessing for any tenderness or any little styes or masses or any lesions in the area. There appears to be no drainage. And while we're here, we're going to palpate the lacrimal apparatus, and we're just assessing for any drainage or redness or anything, and that is not noted in the normal findings. Then we're going to just look at the sclera in general on both sides. It is white. There's no discoloration or jaundice or anything. Looking at the conjunctivae on both sides, and it's pink. It's non-red in color. There's no drainage noted. Or any signs of infection or styes. And then we're going to move on to the eye test, and we're going to just check for appropriate pupil response, excuse me, and we're going to just check here. If you could just please focus on the picture on the wall for me, and we're going to just check to make sure that the pupils, react, constrict and dilate appropriately. So we're going to check for direct and consensual. Direct and consensual. And the pupils did react appropriately and without any nystagmus or any tremors or any abnormality or tremors to the eye. So then next we're going to check the cover-uncover test. If you could please just cover your right eye for me and focus again on the picture on the wall. And I'm just checking to make sure that her pupil focuses appropriately and there's no nystagma or any tremors or anything noted of the eye. And then the other eye, please. And again, her eye focuses appropriately on the picture that she's focusing on and there's no nystagma noted. And then we're going to move on to the extraocular movement test, which is the 6 cardinal fields of gaze. And we're assessing for full movement and of only the eye and direction, and we're assessing for cranial nerves 3, 4, and 6 at this time. Okay, so I'm just going to stand in front of you and just ask that your eyes only follow my pen, please. And her eyes were able to focus and follow without any nystagma or twitching or tophus or any type of tremors. And next we're going to move on to the ears and just doing a general inspection of the ears. Her ears seem to be placed symmetrical in correlation to her head, and there appears to be no rashes or any type of abnormalities, lesions, or anything, or scarring. There is notable piercing on the right ear. We're going to palpate the auricle, and it is smooth. There's no lesions noted, no rashes or anything, and noting again the piercing on this side. And then we're going to assess the hearing, which is cranial nerve number 8, using the whisper test first. I'm going to have Josie cover her left ear, please. And I'm going to have her repeat a series of letters and numbers.
Okay. 1, 5, K.
Very good. And then I'm going to have you cover this ear, please. 6, H, J.
6H.
Correct. And normal findings. The normal findings would indicate that she is able to correctly repeat the series of letters and numbers of 50% or greater. Okay, and next we're going to do the rubber test using the tuning fork. So I'm going to strike the tuning fork and place it on the top of the head, and the sound should be uniform bilaterally and the vibration as well. Okay, so make sure that you hear that unilateral both sides, and the vibration is equally distributed. Okay, and that is normal findings. There's not one side that she hears it and not the other, so it wouldn't be an abnormality. So next we're going to move on to the linear test. So I'm going to again strike the tuning fork and place it on the mastoid process, and this assesses the bone conduction, and then we'll place it in front of the ear here, and that'll assess the ear conduction. And normal findings would be the ear conduction is 2-to-1 ratio, being the ear conduction is greater. And just tell me the steps, please.
Okay.
And then this one.
Okay.
Okay, and I timed it so that the bone conduction was less than the ear conduction on the side, and then we would repeat this test on both sides of the ear. And then we're going to move on to inspection of the ear using the otoscope, and we're going to assess the ear canal and the tympanic membrane, assessing for the membrane and making sure there's no drainage or fluid retention in the ear, making sure that there is a normal coloring, which is a pearly gray in color, which it is, noting a little bit of serum in this ear, and then in the other as well. and I'm pulling the auricle out, back, to assess for that. And up, and then we're going to move on to the nose, which is just, first of all, we're going to inspect the just the general structure of the nose, and we're noting that it is midline. There appears to be no deviation in the bone structure. Just a gentle palpation verifies that there's no deviation in the bone structure externally. There's no redness externally that on the skin or drainage coming from either near. And then we're going to just check the septum and ensure that it is midline and there's no deviation. And we're checking also we're going to be checking for patency of each nair after that. The inspection of the left nair and the right nair reveals that the turbates are normal in color. There's no swelling or drainage or perforations noted. There's no inflammation or deviation of the septum, and mucosa is a light pink in color and no drainage or perforation noted. Then we're going to move along to the mouth and the pharynx. We're just going to do an external general inspection. The lips appear to be pink, and they appear to be moist, and there's no cracking or lesions or any fissures noted to the lips. And then we're going to check the buccal mucosa and the gums, and then the hard and soft palate. And if you could just open for me. And those palates, both soft and hard palates, appear to be normal. You can just stick your tongue straight up. I'm assessing the floor of the mouth to check for any lesions, because this is where primarily most oral cancer lesions are found, is underneath the tongue, and it is normal. There is no redness or drainage or mouth odor noted at this time. Then we're going to inspect the anterior and posterior pillars, and then the uvula and the tonsils and the posterior pharynx at this time. And we're going to just make sure that it is midline and that there's no swelling or exudate or any type of drainage, noted there. The tonsils are visible. They are 2+. The uvula moves freely and is non-swollen as well. And then we're just also doing a general inspection of the teeth, and they appear to be intact and symmetrical. There's a few dental caries noted, fillings noted in the back, and those all seem to be intact and no loose teeth noted. The color of the teeth is normal. And then we're going to go ahead and move on to the gag reflex and the ah reflex, which assesses cranial nerves 9 and 10. If you could just please, I'm going to do a gag reflex. I'm sorry about that. Okay. And then I'm going to have you stick up your tongue and say ah for me. Okay, very good. And those are normal findings as well. And we're going to move along to the neck inspection, and it's just a general inspection of the neck. It appears to be symmetrical. The trapeze muscles seem to be symmetrical muscle tone on both sides. There is symmetry, and there is softness and smoothness noted to the neck. And then we're going to check for the position of the thyroid gland, which is noted and is midline as well. And then we're going to check just visually for no jugular vein distension. If we were going to fully assess the jugular vein, we would have the patient lie down at a 45-degree angle and further assess for that. So then I'm going to just have you do a couple of things. If you could just turn your head side to side for me, and then lean forward with your neck, and then back. Is there any kind of pain or discomfort or numbness or tingling with that associated? And then I'm just going to have you meet a little resistance. Turn my hand here on each side, into the chin, forward, okay, and backward. And good muscle tone and no restriction of range of motion in the neck. It moves freely. And then we're going to go ahead and have you please shrug your shoulders. And we're assessing for cranial nerve number 11 at this time. And then we're going to go ahead and palpate the carotid pulses on each side, in each side individually, and we're assessing for any thrills or bruise, and we're going to assess that with the bell of the stethoscope, and good pulses noted, palpable pulses of the carotid. Pulses are regular. There's no irregularities or no murmurs noted, and no bruise or thrills noted. And then we're going to go ahead and just check the position of the trachea. If you could please just follow. The trachea moves upward in an upward motion when she swallows, which is normal findings. And then assessing here, there's no lumps or nodules noted at all. And we're just going to listen to the trachea. Okay. And then we're going to go ahead and move on to the lymph nodes. So we're going to assess for the pre-auricle, the post-auricle, and we're checking for any adenopathy or any lesions or swelling noted. The occipital here behind the tonsillar. And then we're going to check for the submental, submandibular, the superficial cervical chain, the post-cervical chain, deep cervical, and then we're going to also check the supraclavicular lymph nodes here on the clavicle line on each side, which would indicate a more serious condition if there was any adenopathy here or any findings abnormal, and they are all normal, no abnormalities noted. And then we're going to assess, moving along to the upper extremities. We're going to just visually look here at both arms. If you could just press down on my hands and then meet my resistance when I push down. Okay, and there appears to be good muscle tone bilaterally in both extremities. The color looks normal. There's a few little small nevi noted, and the neck as well, very small. The color is pink, its temperature is warm, and then there's no mottling or anything. We're going to assess the nail beds for any kind of cyanosis or anything of that sort, and we're going to check the capillary refill, which is brisk at 2+. There's no clubbing of the fingers noted, which is normal findings. And then the hair, just noting the hair is evenly distributed on both arms. And if you could just, shrug your shoulders, and then each side to side, move your shoulder up and down. Okay, just checking the muscle tone again. And then we're going to assess for the brachial pulse here. And then we're going to assess on this side for the brachial pulse. And then the radial pulse. It is even, it is normal in rhythm, normal rhythm rate and normal intensity. And then we're going to move on to the back. So I'm just going to have you please slide your back way. Just do a normal, a general inspection of the back. There appears to be a few small little nevi noted, no rashes or anything like that. The skin is more normal in color. The thoracic curvature is normal. I'm just going to have you take a breath, and I'm putting my hands here to make sure that the breath is evenly inhaled and exhaled on both sides, and it is. There's no use of accessory muscles or any dyspnea noted. And then we're going to go ahead and percuss for the costal vertebral angle for any tenderness, and this may indicate if is there any tenderness or pain. This would indicate a potential polynephritis or abnormal findings with the kidney. And then we're going to move back to the lung assessment, and I'm just again watching inhalation, exhalation, just visually looking at for the chest expansion, and it appears to be normal posteriorly and anteriorly. And then we're going to move along to the tactile firmitus and the test, and I'm going to place my hands on your back, Josie, and I asked you each time that I place my hands on your back if you repeat 99 for me. And what I'm doing is I'm assessing for any increase in tactile firmitus, for any consolidations or fluid retention that could potentially be a pneumonia.
99. 99. 99. 99. 99.
Okay, and there's no increase, so that is normal findings. So then I'm just going to percuss on the posterior chest, just checking for any dullness. And there would be dullness normally over an organ, but I'm just checking for any dullness, which could indicate a pneumonia or some abnormal findings of the lungs. And then I would do this in the front as well. And then I would also have her repeat the phrase 99 again in the front.
99. 99.
And there's no increase, which is normal findings. And then I would auscultate the lung fields. And I'm assessing for any wheezing, any rales, any abnormal findings would indicate a potential respiratory infection. Breathe in and out for me, please. And I'm assessing side to side, comparing each side. Normal breath sounds are noted, and there is no decrease. They're even upon comparison of both sides. And I'll be doing the anterior chest as well. And then lateral, and the lateral side. And these are normal. Okay, and then we're going to just do a general, again, inspection. There's, like I said, there's no nodules or anything abnormal findings here. And then the intraclavicular, there's no swelling or anything like that. And then we're going to just assess for the heart sounds next. If you could please just turn forward for me again, I'm sorry. And then we're going to assess for the heart sounds, and we're going to assess for S1, S2 for the rate, rhythm, intensity, and for any gallops would indicate abnormal. We're going to assess for the aortic, pulmonic, the Erb's point, the tricuspid area, and then the mitral valve area. And we're assessing for the rate, rhythm, intensity. There's no murmurs noted, no gallop noted, and these are normal findings. And then we're going to move along to the abdomen next, and we're going to just do, if you could please bring back one at a general inspection of the abdomen. The abdomen looks and appears to be normal contour, and we're just going to illuminate the abdomen and just check for the, again, for the contour, and there's no scarring noted. The skin's warm and dry. There's no bulging areas, which would potentially indicate a mass or a hernia, and that is all normal. And then we're going to go ahead and just do an auscultation. And we're assessing for the bowel sounds in all 4 quadrants, and we'll listen up to 5 minutes in each quadrant. And the bowel sounds are positive in all 4 quadrants. And then we're going to assess for the aorta arteries. So we're going to assess for that using the valve stethoscope here. And then we're going to check for the renal, the iliac, and the femoral arteries. checking for any bruise or thrills, and there are none noted. I have to go back to assess for the diaphragmatic excursion. I'm sorry. I'm going to go ahead and go back now to the chest. I'm sorry about that. I'm going to have you turn your feet. I'm so sorry about it. One more time this way. And what we're going to check for is the diaphragmatic excursion, and we're going to assess the expansion of the diaphragm, and we're assessing for that to measure between 3 and 5 centimeters, which would be normal findings. If it was greater than that, it could indicate some lung conditions or lung dysfunction with expansion of the diaphragm. So how we're going to assess for that is we're going to percuss starting here, and we're going to percuss down until, sorry, Josie, can you please, I'm sorry, take a deep breath and hold it in. And then assessing for the dullness area. When I note the dullness area, I'm making a mark. Okay, breathe please normally, sorry. And then I'm going to have you breathe normally, again, a couple deep breaths, and then I'm going to have you blow out and hold your breath out. Okay, and then again, I am assessing for the dullness area. I'm measuring with my tape measure. It measures 4 centimeters, which is normal findings. Okay, sorry about that. And now we're going to move to percuss the tone of the liver borders and the splenic dullness areas. So we're just, again, going back to the abdomen. Sorry about that. We're just going to do a light palpation here, abdomen, and a deep palpation to assess for any nodules or masses or tenderness, and there's none noted at this time. So then we're going to assess the liver, and we're going to percuss here for the dullness, and we're going to note where the dullness started, and then we're going to percuss from the bottom upward, and we're assessing for the bottom segment of the liver, and we're going to find the right coastal region of the liver that way, and then we're going to move on this side, and normal findings would be no masses and no tenderness or no hardness noted here in the liver area. And then the spleen is located here on the left side, so we're going to assess for any inflammation or enlargement, which could be noted in like a mono infection. So normally, unless you do a very deep palpation of the spleen, you really don't want to palpate the spleen normally, unless unless you would note the abnormalities. So we're just percussing and noting the location of the spleen here. And it does not appear to be enlarged or anything of that nature, and that's normal. And so then again, like I said, we checked for the right coastal margin of the liver border, the anterior and posterior segment, and then on the spleen, we checked for the left coastal margin of the spleen. And now we're just going to check for the kidneys, and we're just checking for any inflammation or any masses on each side, and those appear to be normal. There's no tenderness or anything like that, so that's normal findings. The abdominal muscles appear to be symmetrical on both sides and evenly movable, or strength appears to be normal on both sides. And then we're going to go ahead and move to the lower extremity. So if you wouldn't mind, please sitting up. And then we're going to just note the color of both lower extremities. We're just going to note that there's scarring noted on the left knee as well as the right knee. the temperature of the legs is normal. It's warm and dry. The hair follicles, as she shaves her legs, so we're noting that the hair follicles are evenly felt and distributed on both legs. And then we're just noting the pulses next, and that would be the dorsus pedis here is palpable, and then the post-tibial 2+, and then we're going to note the popliteal on this side is 2+, and then on the right, dorsus pedis, post-tib, and then the popliteal, just 2+, and they're regular on both sides. There's no notable swelling or edema or mottling noted in the skin color or tone or anything like that. Then we're going to move along to the musculoskeletal system, and we're just going to check some reflexes here. So first we're going to use our reflex hammer here. I'm going to first check the brachial reflex. Just if you can hang your arm down, please. It's normal. We're checking for any abnormalities like a hypo or a hyper reflex. And then we're going to do the knee. Jangle your feet here, okay? And then we're going to check the Achilles. Sorry. And the Achilles on this side. Okay. There's no hyper flexion or anything of that sort. So then we're just going to check general muscle strength. And then again, can you please turn your head, like touch your head to each shoulder on each side. There's free range of motion. There's no limited or pain upon movement, is there? No. And then tilt your head forward again, please, and then backward. Very good range of motion. And then we're going to assess the back again. Turn sweep. And just a general inspection, the back appears to be normal and symmetrical on both sides. And what's important to check is the cervical spine here and the lumbar spine. If you could just lean forward. And one way to do that is place your hands on both sides here, and we're just checking symmetry to make sure that one shoulder isn't elevated and the other is not, which could possibly indicate a curvature of the spine in this area, the cervical spine. There's no notable lesions or anything of that sort. This spine appears to be without any curvatures or kyphosis noted, and it appears to be symmetrical, and the spine appears to be midline. Okay. Okay. And then I think that will conclude our video, and thank you very much.